A topic that's worth revisiting many times is the topic of scars and scar maturation and remodeling. It's a process that happens in just about any case where there's either injury or surgery. I have always been asked questions about this particular process because it always seems to be a mystery to a lot of people. Indeed, remodeling or maturation of the scar is an incredible organic process that occurs anytime there is either intended injury such as surgery or in an accident. All scars at the beginning, when the wound has finally healed, are red, raised, and hard. All these scars go from being red, raised, and hard to being white, flat, and soft. That process is what we call maturation or remodeling, and that is where the tissue takes on the form that it will have forever. Scarring is our attempt to recreate whatever tissue has been injured. We no longer are able to recreate the scar, the skin that we start off with. So it's our poor attempt of our body to recreate skin with a scar. A scar has relatively the same type of collagen as in normal skin. It's slightly different, but our body's attempt is to create this collagen that then interlocks. The difference is that in normal skin, collagen lays in a more normal fashion as such. In a scar, the collagen is laid down in multiple different layers on top of each other. So over time, this particular scar will remodel by having the collagen form a more normal bundle over time. This process occurs whether we do anything to it or not. When we massage an implant, we help that process to remodel sooner. You can use anything you want. You can use 1040 weight oil as well as vitamin E, and you will get the same result. What you're looking for is something that will help massage. Whether you massage something or not, a month later the scar looks better. A lot of people give credit to the massage, the medium that they're using, rather than the fact that this process continues on its own, whether you massage it or not. But as I mentioned, it does happen faster when you do that. The other process that people are concerned about or have questions is the fact that the scar is raised and red. Why does that happen? Aside from the collagen, you have extra blood vessels that come into the area to help bring in the type of cells that are necessary to debride, clean up the wound, and then lay down the kind of cells that are necessary to contract and heal the wound. So when you start off with 2 or 3 blood vessels, now you need more, and what happens is we get a process called neovascularization. More blood vessels are actually formed and bring in more blood into the area to help with the healing process. Think about building a house on a new lot, and you have inroads from different directions before the house is built. Once it's built, then you have a nice driveway, circular or not, but you certainly have fewer inroads. Same thing occurs with our wounds. Our wounds, once all the tissue has been laid down and all the cells are there necessary for the remodeling, all of a sudden the redness starts to go down as these extra blood vessels die off. It's a process that is absolutely amazing. It's miraculous, but it does occur. One thing one should always know and understand is that scars will eventually mature. You have to have faith in that. The process can be as little as 6 months or as long as 2 years or even longer in certain situations. So, but in general, one is going to see an improvement in the way all scars look. And obviously over time, people have given credit to all sorts of incantations, medications, lotions, and massages, when indeed this process is something that has been going on since time immemorial.